Hey there, it's Marco from Fit for Work. In this video, we're going to learn about the impact of certain foods and drinks on the levels of inflammation we experience in our bodies. Nutrition and diet information surrounds us everywhere we go, but this video aims rather to educate the viewer on why certain foods make us feel the way we do. At the end of the video, we'll focus on the latissimus dorsi muscle as I guide you through stretch and soft tissue mobilization techniques to prevent injury or manage present soreness. Before we begin identifying all the foods that may increase or decrease inflammation, it is important to understand what inflammation is. Inflammation is very much a good thing in a lot of ways. When a child skins his or her knee on the playground or you stub your toe on the edge of a curb, we want the inflammatory response to kick because that's what promotes healing. In either case, this is an example of acute inflammation, often presenting with swelling, heat, redness, and pain. So when is this inflammation problematic? Chronic inflammation is a similar process, but often it is not identified by visible swelling, bruising, etc. Chronic inflammation is consistent and can last for several months to years. There are many causes of chronic inflammation, including subsequent to acute injury, infection, disease, autoimmune disorder, the list goes on and on. The foods and drinks we consume do play a role in the amount of inflammation we have in our body. Let's first take a look at some foods known to have anti-inflammatory properties. Green leafy vegetables, tomatoes, olive oil, nuts, fish like salmon or tuna, and certain fruits all have shown to help reduce the amount of inflammation when consumed regularly. Of course, the usual culprits, those delicious and desirable fried and processed foods, are on the list of foods that promote the inflammatory response: white bread and pastries, fried foods, sugary drinks, red meat, and margarines are all recommended to be consumed in moderation, for many reasons, but in particular with this case to lower the amount of inflammation in the body. The video is not meant to serve as a nutritional guide, but rather to bring attention to yet another reason why what we eat and drink directly correlates to how we feel and function. So at this point, let's move into the muscle group of the month segment and learn about the latissimus dorsi, or lats as they're called. The largest muscle in the upper body, the latissimus dorsi, acts to move the arm in adduction or toward the middle of the body, extension behind the trunk, and internally rotates the shoulder. Additionally, when the arm is fixed overhead, think of someone doing a pull-up at the gym. The lats pull the trunk up towards the fixed point and forward. This is why pull-down, pull-up, and rowing exercises are often used to strengthen this large muscle group. As demonstrated in all the previous wellness videos, a general warm-up is strongly encouraged prior to exercise to gradually increase heart rate and blood flow by beginning with light cardio activity. Due to the lats' involvement in shoulder movement, it wouldn't be a bad idea to select general movements that include the upper extremity, such as jumping jacks, running, power walking. Or for a lower impact activity, try using an elliptical or stationary bike equipped with moving handles. Once your temperature is rising, respiration is faster, and muscles are prepared. Introduce static stretches, reaching one hand overhead and grasping that same wrist with the opposite hand. Gently push your hips to the same side and reach to the opposing side until a light stretch can be felt on the posterior side body. Additionally, a physio ball may be used to assist with a forward-reaching motion as seen in the middle photo, or positioning your elbows in the tabletop in front of you and from a seated position slowly slide the chair backwards. Either strategy will increase blood flow and encourage relaxation of the latissimus dorsi muscle. Similar to the positioning of the static stretches, we can add slow repetitive movement patterns to make the exercise more functional. The photo on the left demonstrates a forward lean with a forward shoulder reach, grasping the strap paired with a diagonal lunging motion to increase the depth of the stretch. The stretch on the right utilizes a band-assisted squat to maintain a neutral spine while reaching well overhead to target the lats. Using a foam roller or a lacrosse or massage ball along the side body in the area between the armpit and the ribs to create gentle pressure in a top to bottom pattern is a great way to decrease muscle tightness and alleviate soreness by increasing blood flow to the muscle tissues. As always, the cool down is a crucial part of a workout, so if you are using these recommendations in sequence with a cardio or resistance routine, be sure to save some time at the end to stretch and foam roll in an effort to prevent injuries and reduce onset of soreness post-workout. Thanks for tuning in to the March Wellness video. Alyssa and I continue to use virtual resources to connect and support employees across all departments through the current remote model. Please contact your supervisor to help set up an appointment. Have a great day.